In just 1 month, India has added more than 6 million new cases, and this is just the official tally. Resources are so stretched right now that not everyone who has symptoms or is sick can get themselves tested, which is why most experts believe it's quite likely that the real outbreak in the country is a lot larger than what official numbers are telling us. There are similar concerns as well that India may be underreporting its COVID-19 deaths. Crematoriums across the country are running round the clock. Here in New Delhi, India's worst hit city, parks, open spaces and parking lots are being converted into crematoriums and funeral grounds as space runs out. Families who've lost loved ones to COVID-19 describe horrifying scenes of snaking queues of bodies lined up at these funeral centers, with many saying that the wait to cremate or bury family members sometimes is lasting an entire day. Last week, Delhi's official COVID-19 death toll had more than 1,000 deaths missing, and experts say India's fatalities are likely 5 to 6 times higher than what official data are showing. India is in crisis. Its healthcare infrastructure is crumbling, and most people are dying now because it's impossible to access medical care. In India's capital, which has been under lockdown for more than 10 days, hospitals still don't have beds and oxygen, and people have been forced to turn to the black market to buy oxygen at exorbitant rates. Similar reports of shortages also coming in from rural India, where healthcare facilities have always been inadequate. In the last few weeks, demand for medical oxygen has gone up by nearly 70% across the country, and while the government is now importing oxygen generation units and respirators, critics say it's too little, too late. Prime Minister Modi's government is facing mounting criticism over mishandling of the crisis, with many calling for his resignation on social media. The explosion in infections has been blamed in part on a new virus variant, as well as on mass religious and political gatherings that were being held until a few weeks ago. And as cases continue to surge, many countries like Australia, Canada, the UK, many in Europe and Asia have all imposed travel restrictions to and from India. But as bad as things seem right now, experts are warning the second wave of infections will likely only peak by mid-May, and by then India could be recording upwards of 800,000 cases on a daily basis. Neha Poonia, SABC News, New Delhi.